John Decker, the Director of Community Services at Alta California Regional Center. Welcome to Coffee Coffee with Community Services. Oh, excuse me. Everyone still joining here? A few more. We have some guests that are here today, and so we've got Beth and Harry, and we've got Aaron that are going to be providing a presentation here and talking about the emergency staffing registry and the contract that we're working on with the Columbus organization. And as usual, we do a introduction of our staff. It seems like we have approximately half of Alta California Regional Center currently on logged in this morning. So I will say everyone's names are right there. Good morning, everyone. We don't want to take a huge ton of time, but really appreciate so many people logging in today to learn more about this. I am going to be sharing the screen and controlling the presentation, and I will kind of introduce Aaron first, who can then introduce the rest of the team, and we will go from there. So as folks would remember as well, this is a meeting that is recorded and will be up on YouTube on Alta's YouTube channel. And we will also be sending this out to our service providers, the link to it, in case they weren't able to join. So with that being said, I'm going to now share my screen and we'll launch the presentation, and I will introduce Aaron from the Department of Developmental Services.
Good morning, everyone, and thank you for allowing us to spend some time at your meeting to present on what I believe is a very important project that we've been working on for a little over a year now to refine and roll out. My name is Aaron Christian. I am the manager of the SoCal Community Operations for the Department of Developmental Services. And I have a couple of people here with me that will be co-presenting and chiming in here. So I want to give an opportunity to Beth to introduce herself, and then Harry.
Hi, Beth Reiniger. I'm the Vice President of Quality Improvement Services at the Columbus organization. I think some of you are probably familiar with Columbus through our clinical staffing division. The Quality Improvement Services division has done a lot of work in California as well and has been a longtime partner with DDS, so we're happy to be involved in this project.
Hi, and I'm Harry Brohl. I'm a service provider with an agency called Pathpoint in Southern California and Central California, and been working with Beth and Aaron on this project.
All right. Well, thank you. And so what we're here to talk about is an emergency staffing registry. This registry is done in partnership with the Columbus Group, who is the contractee, as well as Alta Regional Center and Tri-Counties Regional Center. This has been a project of ours that we've been talking about since 2020 and the height of the pandemic, which I think really highlighted the need for this type of service. So before we jump right into the overview of the project, I want to share just kind of some of the motivation to create a staffing registry. So on the next slide, I kind of included some specific emergency situations that arose in Alta California's catchment, or Alta Regional Center's catchment area. So just last year alone, CAL FIRE reported 23 fires that occurred within Alta's catchment area. That's not even including any other inclement weather situations that arose. I know that there was some heavy snow earlier in the year that impacted service providers and their ability to provide services. And just generally speaking, we recognize that California in itself is prone to emergency events. And as we all experienced the pandemic, I'm sure many of you have had COVID-related impacts to service delivery and ability to staff adequately. So I think we all recognize that we are not emergency situation free in California. So what we did is we pulled together a project team and started talking about ideas on how to brainstorm and address staffing shortages during times of emergency or emergency events. So in a nutshell, I think on the next slide, we kind of just I'll give you a little brief overview of the intent of the staffing registry and kind of what it is. And then I'll kick it over to Beth to talk about the logistics of it. So like I mentioned, we're not, free from earthquakes, fires, floods, mudslides, snow conditions, which I know in California we don't see a whole lot of rain or snow, but it does impact us on occasion. And what we've learned is that, during these times, it can really put a strain on our service system to be able to meet the needs of the community that we're serving. If there are, huge mudslides that impact road conditions, you may have staff that can't get to a particular side of town. So how do we address getting people to provide those needed supports to those individuals that may be impacted? And so what we were trying to accomplish with this project, or what we aim to accomplish, is to kind of pull our system together and try to pool resources so that we can all support one another. And in doing that, what we're asking is that the concept, or the foundation of this program, is that if we could get every service provider to add people to a registry, then during times of emergencies, we could activate the emergency registry, and we could potentially use those people to fill in service delivery gaps in other areas. So the idea is to have this be a statewide resource, and that way we would be pulling people in a registry statewide. This would help us kind of better prepare for emergency situations, such as the pandemic, such as fires and earthquakes and things that I've mentioned previously. And the goal would be able to provide that continuity of care during those times. So, with that being said, we'll kind of get into how the pool will be developed, and I'll kick it over to Beth for that portion.
Yeah, great. Can we go? Yeah, there we go. So we're going to develop the staffing pool, like Aaron said, to meet these needs. And what we've worked out is the method would go that we have a worksheet for providers that agree that they have staff that they would be willing to have volunteer for this. So we have a worksheet developed for them where they can fill in the staff information, and we'll take that and then connect directly with those employees that are interested in being part of the registry. And Columbus would onboard them into our human resources system and do all of those things so that we're ready when the events come about and we can deploy them. And then as things come up, a regional center, whatever regional center the provider works with, would be the one that would actually request the staff through us. So it would have to be some type of an emergency that the state has deemed that we're going to activate this staffing pool. And then once it's activated, you would work with your regional center if you had a need, and they would determine whether the need could be filled in another manner or if they need to reach out to Columbus. And we have a request system set up, like a ticketing system, where they would put that request through. And then when the request comes through, we're going to try and match staff the best we can to their preferred geographical location, to their skill sets, to the settings that they're accustomed to. So those will be the first things that we're going to try and match. If we can't, we'll move to a different county or whatever, but we're going to try and stay within the parameters that the staff have said. So any staff coming into the pool can say what counties they prefer to work in. They can say days they prefer to work, shifts they prefer to work, settings that they're familiar with, any skill sets they have that might be requested or required. So we're going to try and match it up the best that we can. And the most important thing about it, I think, is that throughout the process, there's going to be communication. So as soon as that ticket goes in, the provider that requested it will be notified. The regional center will get a confirmation that it's been submitted, and they'll know we're working on it. And then if we fill it, if you have put forth staff for this, we will have all of their appropriate supervisor contact information available. So if one of your employees says that they can work it because they're not working a shift for you, you will be kept in the loop that they have been assigned. So you will always have the opportunity to say, no, like I need this staff, my home comes first, which is absolutely true. So everyone will be kept in the loop. You can intervene at any time and tell us, like, this staff person can no longer be part of the registry. This staff, I don't have any staff to spare right now, whatever you need to do. we'll be keeping you in the loop, and we'll also be updating you as often as you want as to the staff that you have included in the staffing pool. So at any time, if you get that report, you could say, you know what, this person left the agency, or this person, I don't want them to be part of this anymore. Anything like that, we are certainly open to, and we want to have open communication with you for that. And I think another thing that's important to note is that Columbus is not going to hire any staff that we place for you. They'll be in our payroll system just to get paid if they work on this project. We're not trying to take them from providers. I think the primary focus of this is DSPs, while we would look at other staff too. That'll be the primary focus, and we do not we don't staff DSPs. We do professional clinical staffing in the other division, but we're not doing that. We're not going to be taking staff from anyone, so they won't be offered permanent positions with us. Let me see, did I miss anything else on this one? No, I think that's pretty much how it would work. Staff will be supported throughout the process. We have plans to do regular training with staff, so your staff would be eligible to receive some additional training to keep their skills sharp, to make sure they're prepared for any setting they go into, to make sure that they have all the emergency preparedness training that might come into play in something like this. You know, all of those things. We've worked on some topics, and we're going to keep people trained and ready to go. I think, Aaron, did I miss anything on that part on the development?
Yes, I will say, I was just gonna, before we move on to the next slide, I just want every service provider that's on here to just look at those 4 points there at the bottom, like one more time, because that is what 99% of the questions that come up related to this are about. And I think the restating of the protections that are included for service providers just cannot be said enough. And so I don't know if it's probably not opportune. We can go to questions later on, but I just want to ensure all the providers that are on right now are really looking at those 4 bullet points and recognizing that there are protections put in place, so that, as Beth just said, we're not here to be stealing staff, because there will be no opportunity for them to be hired on with Columbus that way. That is not a part of this.
Exactly. And we spent a lot of time trying to build in kind of guardrails as to how to mitigate this issue and make it clear that, you know, this isn't going to be offering full-time work. It would be limited in scope, and, you know, that staff would return back to wherever that, you know, whatever service provider referred them.
Yeah, I mean, it's really just goes back to this being a partnership between all of us, really, and we really see it as providers supporting each other, and we are just here to be the mechanism to organize this for you and to pay staff, and that's it. It's not even our clinical staffing division isn't even involved in this. It's a separate division. They will not be the staff working on filling these positions or talking to your staff, anything. It's not even related to their division, if that makes anyone feel better. But yeah, it's absolutely separate, and you know, again, we're just here to support it. We're not looking to pilfer staff from anybody.
All right. Go to the next slide here for you.
Great. This, you know, pretty self-explanatory. These are the facilities, the types of facilities that we have worked on with the regional centers and DDS to identify that these are the types of facilities that staff may be assigned to. And, you know, if you agree to bring staff into the registry, you'll see that we have set up a worksheet where you can fill in the staff's personal information, but you also can select from drop-down menus of the type of facilities that they're familiar with or comfortable in. We don't want to place someone somewhere that, you know, they wouldn't want to go. So all of these types of facilities are on that worksheet and can be selected for any staff you have if they have personal preferences or experience specific to these. And then this one is the best one. There's no charge to the provider receiving the staff. So DDS is graciously funding this through contracts with the regional center. So again, this is only, you know, DDS will be controlling when this gets activated in terms of what warrants an emergency situation and when it is needed. And once that goes up and the registry is active, Providers can access this if they're affected by the emergency at no cost.
So I know our providers may be a little suspicious about no cost activities and hearing that in a regional center meeting. So maybe we can just explain that a little bit more, because I don't know how deep we get into it in the next. Nope, we don't, because we're at the discussion slide next. And so we want to really clarify what we're looking at here, which is there has been a contract that we have set up. The contract is coming from DDS. It's passing through Alta California Regional Center to the Columbus organization. It's a operations funding type of contract that goes through. This allows us to be the Northern California hub, in essence, for this service. And we, as we've done with a number of different types of services, and Jordan's on here and probably some of her staff, most of the specialized services that we have, we are hubs for Northern California. We have specialized homes, we've got specialized programming. And so this is us, again, as a regional center, and Lori supporting it, us going out and trying to do something new and different for the first time, to try to provide as much supports as possible to you all as service providers. So that means that DDS has put a chunk of money behind getting these off the ground, but not for the purposes of it being a one-time short-term type of thing. Harry and all of these folks have not put the efforts into this for it to be a short-term pilot year thing. And so that's the other thing with the regional center, with Alta at least, when we get into doing these types of agreements and arrangements with DDS, we also commit ourselves to working to see how to develop long-term ways of funding services like this. And so, our contracting with Columbus, we already kind of started some of the language that we would be looking there, but Alta has committed to help, and also kind of look at an analysis of this as well, because we're going to have to analyze a lot of this when determining what ongoing costs would look like and things like that. So the no charge aspect of it is what is covering this service at this time. Meanwhile, just know that the regional center is looking at long-term solutions with DDS and with these partners. So I don't know, Aaron, if there's anything else about that I missed, but I always want to make sure folks know why things might be free right now.
Yeah, and I think you covered that excellently. I think it's helpful to kind of give examples, and I think the two that have come up the most in our conversations similar to these have been how does this function? Can you give us an example of how this functions in a residential setting? And then supported living is usually the second one that comes up. So residential setting, let's use COVID as an example, because I'm pretty sure that most people, this is a reality for the past 2 years and probably still ongoing. You have a staffing shortage because staff tested positive, residents maybe have tested positive, and you have staff that can't come in. So you can't fulfill, let's say, the knock shift for the next upcoming week. And there's no options. You don't have staff. The people will be left uncovered. This is where this type of registry could be activated, where we can technically deploy registry staff to cover those shifts for that duration, until staff either tested negative, residents tested negative, or we could get the situation back to routine. Same would happen with fires per se. Let's say you had to evacuate. The Columbus Registry potentially could support someone in a non-home-like environment, whether it's a shelter or alternate living location like a hotel, and help provide the coverage if the staffing need was there. The other piece that came up pretty frequently in our questions with other providers was supported living. Well, how would this interact with supported living? Regs say I can't subcontract, things of that nature. Well, in supported living, we kind of view this registry almost like how you would layer in-home support services, where Columbus would provide the support during those shift shortages, and then SLS would pick back up, in the alternating shifts. So again, using the same example, say you couldn't, SLS provider couldn't provide the knock shift. Technically, the registry could potentially come in there and fill that shift. And then in the morning, SLS would kick right back in and they would pick it up. And since the contract is with the regional centers directly, the they would have no, there wouldn't be any Title 17 conflict with subcontracting out, because the SLS provider is not the one sending the staff.
Yeah. And the other thing I just wanted to reiterate that we haven't talked about is like a lot of people say like, well, we're already having trouble staffing. We have staffing issues now. Like I can't spare the staff. We're trying not to think about this as this moment in time. We're trying to think about it as this long-term solution, and that we're going to hope that you're not always in that same situation, and that there's going to come a time where you would have staff to spare, and we want to be ready for it. And the point of the fail safes in there is that to make you feel better about it, in terms of, we're not going to take staff. If you're having staffing shortages and you absolutely can't spare staff, we're not going to take them. That's not the point of this. But down the road, hopefully everyone will be in a better place, and we'll have this system going already, and you'll be able to support other providers.
I had asked Harry if, I'd asked Aaron if Harry could be part of this, because I wanted Harry to kind of give some feedback about it. So the why, you are a California service provider, right? So why was this interesting to you, Harry? And then what kind of supports have you received to implement this from DDS? Because I think we had talked about that at a previous meeting, and I think it might be good to share with folks as well.
Yeah, I'm not sure how much I can share on the last part, but I can certainly speak to why we're interested in supporting this approach. So we're mostly day services, SLS, ILS, employment. And early on in the pandemic, there was the time when we were getting a lot of retainer payments, and the residential was really the group homes and ICFs were just being inundated. Because, and probably a lot of you on this call are we're part of this, right? Where not only were you having short staffed and people getting COVID, but you were also having to staff 24/7 instead of having folks leave during the day. So we were very interested in how we could help support this, and our staff wanted to help, and how do we get involved? And so we tried it a lot of different ways, doing it directly. So we connected to residential providers. We had a DDS work group at one point on this, and we kept running into challenges, just getting agreements. So we had a template for agreement. We tried different agreements between a residential home and a day service provider, but we came up with things like liability. Like, boy, what happens if something happens to a person in the home? Are we liable because our staff member's there? Is the group home liable? What if our staff member gets hurt there? Are they in our workers' comp or their workers' comp? And are their safety procedures the same? We got as close to actually launching something and sent some staff to a group home, and the staff called us about an hour later and said, you know what, their safety protocols aren't the same as us, and I'm not comfortable working here. And we pulled them out, and they came back. We didn't even begin to get into things like employment law. If we send a staff over there, are they getting their 10-minute breaks? Are they getting their meal break for 30 minutes? And then the whole issue that Beth talked about of sort of stealing staff, but that was a big worry. What if we send some staff over there and the group home really likes them and they like it there, and we'll never see that staff person again? And right now we're all struggling for staff. So when DDS came up with this idea, I thought it was just brilliant. Let's get a third party who can handle all that. So all we have to do is say to our staff, and for our staff, for the ones who are interested, it's a benefit, right? It's like, wow, I could go do this kind of thing and get paid a bunch more money and have sort of this adventure helping out in an emergency. And so it's sort of a, here's another benefit of working for PathPoint. You can participate in this. So that's sort of where it is now. And for us, we don't have any of the headaches of the legal, the employment law, the liability. All that is off of us. It's all on Beth, which is fine with me. And she seems happy to take it all on. So that's a really good thing. And I don't have to worry that Beth is going to steal our staff, because that's written in here that it's not going to happen. So we're excited about it, see it as a benefit. Where we've gotten to, John, because I think that's sort of you're going, is we have passed the registry around. We have a few folks who've signed up who are excited about it. It's not a lot of people. We're terribly short staffed like most of you. You know, we're looking at the long game. You know, if Beth called us today and needed people, we'd probably say we don't have anyone because we don't. We're short staffed, but we're looking at it for the long term. And hopefully, as we are able to staff back up with the rate increases and we can pay our staff more, we'll have more people get interested and put them on the registry and we'll be ready. And it could be one last comment is that I know it's set up for thinking, helping out residential, but it could be anything. Down here, we had a huge fire in 2017, followed by mudslides, and the 101, which is the main route between Santa Barbara and Ventura and Oxnard, closed for weeks. And we had staff that go around. It's usually a 30-minute drive, and the workaround is close to 4 hours. So we had staff that just couldn't get to work. So we could have used it to getting help in our day services at that time. So I guess you never sort of know when it could come up. So yeah, right now we see ourselves donating, but we could be a receiver too down the road.
Yeah.
Thank you, Harry. And that was what I was hoping we were going to ensure that we got that message out there about what the experience of a service provider that's kind of already involved in it as well. And the way you described the supports is exactly kind of what I was hoping for, that folks would understand that there's significant funds built into the contract with Columbus organization to deal with those types of issues. They've got a lot of administrative dollars that are built up into this to take some of those burdens, hopefully, from the service providers that are donating and receiving it, and instead allow Columbus to handle a lot of those logistics. Anything else about that, Aaron, that to clarify?
No, I think Harry did a good job of kind of summarizing his experience. So hopefully people found that helpful. I mean, I would love to open it up for discussion and comments and feedback and what's giving you heartburn, what do you like about it, all of that. So
we had one in the chat already, so maybe we can start with that. So the chat question was, how does this apply to transportation providers? And I would say that a transportation provider, my assumption is if they had staff that wanted to be donated to work in one of those different settings that we shared earlier, then they could be a part of that. Is that accurate, Aaron?
Yeah. There's no service line within our community that we would turn away. So if you had, aides or drivers or whomever that could potentially step in and provide services, we would certainly take them.
Yeah.
Thank you. And that was from Jim Kaiser. Antonio's got a couple questions here. I saw him perk right up when you talked about the ICF challenges that occurred last year. He can talk to you intimately about those things. So the questions are: what is the process of activating the emergency staffing? And then the second one is, how much are they getting paid? What is the incentive for the staff to do this? So I guess this first step would be, what is the process of activating the emergency staffing?
So essentially, it would be if you have a staffing shortage that's a result of emergency. So some of the things that I listed were fire, earthquake, floods, mudslides, pandemics now is going to be on there. You would first initiate the conversation about your staffing needs with the regional center. And the reason we built it in with that structure is because a lot of regional centers have developed localized resources to try to address local needs. I think the staffing registry, the statewide staffing registry, would pick up when those needs just aren't going to be able to meet the need, or the need what the capacity they have locally. And so at that point, the regional center could reach out to Beth and say, hey, we have a need in this particular home. These are the shifts that need to be covered. And then that gives them the ability to start calling down the line and putting out feelers to see which staff on the registry could fulfill that need. And I should add in here too, because we didn't really talk about it, was this is a statewide resource. So we have, it's not like the Tri-Counties is covering the Southern hub. So, and it's not like Tri-Counties only covers Southern California and Alta would only cover Northern California. It is very possible that Southern California's hub could be sending people up north to meet a need if that's the way it works out. So we just did that so we could have a little bit more localized recruitment efforts and support and like a local presence within the area, just because California is pretty vast in terms of our coverage area. So logistically, I think it made a lot of sense.
Yeah.
And the second question was,
The second question was about the how much are they getting paid?
so the DSP start at $30 an hour. We do have the ability to recruit for other categories, and so we are open to taking RBTs, LVNs, RNs, administrators, anyone that wants to be a part. As we saw in the pandemic, all of those categories were impacted by COVID at one point. So the rates would vary and go up based on the licensing or credentials for the staff.
And we have a full list of all of those. Obviously, that would be available for review for anyone that is, has that interest in it. All right. Besides catastrophic events, what other emergencies would you consider a need? And again, I think this is a good idea to talk about the initial idea of this, as we already, have kind of talked about, and then honestly the reason why Alta is interested in it and wants to promote it, which is the opportunities for the future utilization. And so if you could just touch on that again, opportunities for future utilization beyond catastrophic events.
I think at this point, the registry is designed for catastrophic events. Once we kind of get a handle on that and see how that works and make sure that we've ironed out every, any potential barriers or drawbacks to that. We're open to considering it for other things. We just have to kind of figure out what would those categories be and how would this registry be appropriate for that.
And when it comes to doing the work with like CMS, if for example we're looking at like long-term payment stuff, like that's going to have to be articulated like really in depth because of just all the different ways the feds have to, talk about how money is spent. So, all right, if they are evacuated, does DDS pay for the evacuation shelters? So maybe Antonio, I might have you unmute yourself specifically for that one. Just to kind of clarify, is that if like the staff are evacuated with the clients, will they fund it, or what is that?
Yeah, I was thinking if they are evacuated to like a hotel, would DDS pay for it?
This particular contract is covering the staffing.
The staffing only.
The costs associated with the staffing. So if we had to, like the example I used before, if we had to send someone from like the Southern hub up to Northern California, the staff that are part of that registry would have their lodging and get per diem for meals and all of that covered, as well as their salaries. That's kind of the what this particular funding is covering.
So the providers will have to cover the cost on shelters, like hotels and stuff.
Well, you can reach out to us. We, especially with the fires, we certainly have figured out which hotels will work with us these days and which ones won't. And so I know we're working to keep the list updated of which hotels we have direct contracts with.
Okay.
And then also working to, we can do things like those emergency vendorizations in situations like this, where we need that, immediate, especially when the options that are offered by, the local folks that are doing it really aren't sufficient to support someone's physical support needs and things. So the other thing, and this was one, I think this is kind of more of a comment than anything else, is what if there's a mass resignation at a facility or something like that? Would that be something, maybe there's hopefully maybe that could be considered in the future as something that might qualify for accessing a registry like this. Is that pretty good, Antonio?
Thank you, appreciate that.
All righty. This is a great next question. Are staff being screened? So again, going back to the slide before about the responsibility of the donating, manager or owner. So our staff being screened, let's say a staff member was written up for mistreating clients and they want to go work at a different facility. What actions are done if this occurs at a different facility? If this led to an allegation of abuse, are all homes this person was at under investigation? So there's a lot that's going on in that question, but one thing I want to touch on it. Well, I guess one thing is if the responsibilities of if we could talk about the responsibilities of the donating company, and their input as to where individuals would go.
So I think that's the part where the communication is going to be crucial, and that's why we built in those safeguards. Was in order to prevent people from signing up and potentially being deployed without the referring provider having any knowledge or say in that process was a concern of ours. So the way that we've worked it out is that we ask for a point of contact from the referring provider, and then we work through that point of contact to accept people onto the registry, as well as before we deploy anyone. So they would be the person that would be contacted and say, hey, John seems like he can work this shift. It all lines up. We want to deploy him for the next 7 days. Would that impact you? And the answer would be yes or no. And as part of that referral process, we're kind of hoping that the referring agency would give us staff that they feel comfortable going out and being deployed into other settings, have that skill set, hopefully wouldn't have those concerns. Now, in terms of what happens if there's abuse allegations, all of those rules still apply. Any regulatory rule, if they're in a licensed setting, or would still apply. All the staff will be fingerprint cleared, so they'll be, in the specifically for CCL in their system, and so they would still have to be associated in DSS on that process, and they're supportive of the idea. So we've worked out that, and also CDPH for the ICF side. So all those safeguards are still built in, but if something happens or an event occurs where there's an abuse allegation, everything would remain kind of status quo as to the response for that.
Thank you. I know there was some discussions that I know, obviously, whenever the state, is going to enter into a contract like this with Columbus, you have to have discussions with the other agencies that, would be impacted as well. There was the discussion about the, and then there's a question down here about this, about the DSPs, and, let's jump into some of the discussions, and then we'll see if there's something else related specifically to the ICF world. So how long did you say a DSP can stay on the registry? And then there's another question, how, in lessons, how long would these, we've already created an acronym, the ER staff members. So the emergency registry staff members, look at that. So how long would that be in place? So right now, how long are we for the DSPs? There's not a time limit per se. We're just getting this initiated and hoping we find, obviously, continued ongoing support financially.
Correct. And as part of Columbus's role, they'll have periodic check-ins with the referring provider to make sure that they're still employed, still in good standing, and still want to be part of the registry. The other piece will involve keeping updated contact with the person on the registry, the employee, the DSP, to make sure we have updated contact information, because we don't want to be in a position where an emergency situation happens and we start calling and we have inactive numbers, bad emails, and we're just not able to get a hold of anyone. So part of it is keeping it updated. So there's no time frame in terms of like a expiration date that people can be on the registry. So long as during those updates, they're saying, yes, we're still interested. Yes, that's still my availability. They can remain on. So hopefully that answers that.
I guess just a follow-up question. This is Delia Quinley from Quinley Residential Care. Maybe just a clarification. So anyone can be hired to the registry from outside. It's not just coming from referral from providers, correct?
Wrong.
No, at this time, we're trying to keep it focused on referrals from providers.
Oh, okay. I mean, that first of all, I appreciate these extra resource for us. Yeah, I think that's kind of my main concern initially, is that, putting myself as a DSP, there are people who would rather just work in a registry and not work with an employer. And also at the same time, I don't know if I can enforce that legally under labor law to actually say, I don't want you to work, or I don't want you to transfer in a different, work situation or work arrangement. I don't know if I can, enforce that, because they are at will, based on our hiring process, they are an at will employees. And I do not have a say whatsoever as an employer to say you cannot work at a certain, at a different work arrangement. I appreciate that Alta is, has something in place that says, they're going to check in with us, but I don't know if we can enforce that whatsoever.
Well, there would not be an opportunity for them to go work, because there will not be. So we can't have some new high-paying registry come in and draw the staff away from our current providers. So there is no opportunity that would be made because to be able to be to be able to just go work for the registry, for example. Like that's not part of what we're bringing into our community here with all of this. And so, and maybe Beth might have some specifics as it relates to your ability to be able to, once we have this contract set up, to be able to add staff to it, as needed. So Beth, I'll let you jump in there.
Yeah, I mean, that's why we set it up so that they had to be with a provider for a lot of reasons, because I think the whole goal of this is that we want to have staff supporting other providers that have the experience with the individuals, which makes this a little bit better. So we want people that we know are in good standing, are working in the homes now, and we want those people to be part of the registry. In terms of you not being able to tell them that they can't do it, I mean, I think that's where the fail-safe is there with us, because you're not even really telling them they can't do it. You're telling us they can't do it. And then that means we're not contacting them and we're not placing them. It's kind of a behind the scenes action going on there. You would still be considered their primary employer. We are just, on the side here for them. So I don't think there'd be it. And at least from our front, we're not going to put someone in a position if their employer, their primary employer, says they're already working a shift for me, or I can't spare them right now, or whatever you would say. We're not going to say, nah, that's okay, we're still going to place them. We're not going to place them. So I don't think it would become an issue for you.
I actually appreciate that.
Yeah.
Thank you.
And thank you for that question too, because these are the things that are on the minds of people that are interested in getting into stuff like this, because everyone has had challenging personnel issues, specifically. Yeah. So again, also recognizing that, there's a lot of controls on Columbus as it relates to this, because it's just this direct contract, and, if there was issues or abuses or anything like that, the contract would just go away. So anyways, that being said, I know that there are some more questions that we have in the chat here. And I think what I will ask is, do we have any, service provider here. ICF staff are not DSP certified. Would they be allowed to work on a CCF facility? And then is there any training involved before deployment?
Two really good questions. So as most are aware, in the regs for DSP 1 and 2, there are timeframes for that. So because this is not a long-term staffing solution, it's really narrow in scope and narrow in time of deployment. We don't anticipate that people would run into that DSP certification issue from the time that they are deployed to the time that their deployment ends. With that being said, in our initial conversations with both CDPH and with DSS, understanding that this would be deployed for emergency situations, there is already ongoing discussions about trying to figure out long-term plans on how to address when this contract specifically is enacted and deployed into facilities within their settings. So we're already starting those discussions to figure out if there's any room to develop a specific process for this contract. So more to come on that, but the initial discussions have been very positive and both parties are very receptive, because everyone has seen what the pandemic has highlighted, and that is this gap in our service system, and how do we ensure that services are continued. So good question, but yeah, I don't think it would impact DSP certifications.
And we have a couple more questions here from one of our staff members, and so I think it kind of will allow us to restate a couple things that came up during the presentation. So one of the questions was, is there a minimum number of hours that you have to have for the employer in order to donate, that staff? The assumption is that the employer themselves would want to, I would assume, get as many hours possible out of a staff person prior to adding them to a registry to go work for another service provider. And so, again, I don't know that there is a minimum number of hours, or but it would all be based on the donating employer's discretion, basically, right?
Correct.
Yes.
And then you also previously discussed, I think it was Beth discussed about if a staff works at, place A and they, and they're doing emergency staffing at another place, is there something to prevent them from quitting place A and then going to work for place B? And
Yeah.
you talked about this all being kind of a team that we're on here, all joining together for the cause of that, and having staff bouncing from one place to the other certainly doesn't seem like it would be fantastic teamwork.
Yeah, we've talked about this quite a bit on the work group calls, and I think we came to the conclusion that we couldn't stop people ultimately from doing it, but we're putting in their employee agreements, we're putting in a section saying that, you'll agree that you're not going to go work for another employer, and then we're having receiving providers sign an agreement, just that they're going to hold up their end of the bargain in terms of how they treat the employee, but also that they will not be recruiting and hiring staff that come. I think we determined that you probably legally it would be a fight to enforce that, but we're going to try to discourage that and put that out up front, that the expectation is that they will not go to the new provider.
Yeah, I don't. Yeah, I would hate to get into too much of the more negative sides of that and the ways in which would hate to have to kick a provider out of the registry if we that those types of things are. Yeah, so I think there's lots of room for discussion, hopefully, before we get to a point where we have those types of issues. Other questions that folks have? Oh, Aaron, go ahead. Yeah.
I just want to add that, Beth is right. Like we've talked about that, but just keep in mind that right now this isn't a pilot. So, we're really open to feedback and looking at things. I am absolutely certain that there will be things that come up and situations that come up that we did not discuss, did not foresee coming up, and welcome feedback for anyone that's a part of it to tell us, this worked, this didn't work, and it'll help us improve things hopefully along the way. So hearing situations like that will help us address some of those issues as they arise, and hopefully develop some long-term solutions to that. But yeah, so I want to put that out there.
All right, so I guess we need to talk about what the next steps are for everyone, right?
Well, hopefully everyone's just going to flood us with referrals for staff, and we'll develop this really healthy, robust registry.
Yeah.
But what we've done in the past is, after presentations like this is just a kind of brief overview, just to get the concept out there and kind of what we're trying to accomplish. And the way we've handled it, specifically with Tri-Counties where we're piloting this, is we've had smaller kind of group, meeting with groups of providers or even individually with providers to kind of talk through the logistics, and go over the forms that we use, and then talk a little bit more about the communication process and onboarding with Columbus, and kind of get into the nuts and bolts of the project, and then move from there. And then everyone's level of comfort in referring people and getting that process going. So that's kind of the next steps usually with the way that we do it.
So can I get let's see if in the chat, maybe if I can get a little indication of how we're feeling towards this. So can I get a thumbs up or something in the chat if you would like Alta to host a meeting that can go over the actual steps to implementing this for your agency? So we would host another meeting. It probably would not be with Coffee with Community Services, and we would actually go over how to get added to it. Is that something that folks are interested in? You're welcome to put it in the chat. You're welcome to unmute yourself. But we want to get a feel for it. I think we had about 80 to 90 folks on. We've got 85 on right now. So we have one company that seems like they might have an interest in it. So that's one more than we had before this meeting. So that's good. I see Antonio as well. Okay, very good. So again, we will make sure that we connect with you all. I see, again, more coming into the chat. So thank you very much for that. We'll provide an opportunity to do a more in-depth, how to get involved with it. Have you guys done one of those at Tri-Counties yet?
Yes. Yeah. We usually bring in a handful of providers at a time, kind of talk through things. It gives opportunity for you as a service provider to ask agency specific questions. This is how I, schedule people. This is how would this work in my situation? So that way you can kind of ask those unique scenario questions.
Yeah. And the only other thing, I think someone had asked about training and we forgot to circle back to that. They will be given some orientation when they come onto the registry, just a brief one, just an overview of how it'll work. And then they'll be given regular training. I think we determined every other month on specific topics like the settings and emergency preparedness and stuff like that.
Excellent. Thank you very much. And thanks for the folks that are dropping it in the chat that they are interested. We will certainly follow up with you guys about this. This is our presentation for today, and then we have a couple quick items for our regular Coffee with Community Services meeting. But I want to thank Aaron and Beth and Harry for coming by and presenting all of this, and certainly looking forward to getting this pilot up off the ground, and hopefully we can provide some support to you all. I still think of last January when we had one DSP covering 4 clients and homes for multiple days because of COVID and all the challenges that we were facing. So,
Yeah.
So thank you very much for that. And we're going to switch over to just a few quick items before we get done today. We're going to update you guys on the rate study. We're going to update you guys real quickly on the CPP stuff, and we've got a company closure that we're going to go over real quickly as well. So. You guys are, Beth and Aaron, certainly welcome to stick with us. But I'm going to just throw it over to Olivia. Proceed. Oh, Beth.
I'm going to go. Thank you, everybody.
Bye. Thank you, everyone, for letting us join your meeting.
Yes.
Thank
Awesome.
you.
Bye, guys. Thanks. And thank you, Harry, too.
Yeah, thank you.
All right. So, Olivia, if you wouldn't mind just giving a brief update about what we learned about TTSR and kind of where we're at right now.
So we learned last Friday that, or early this week, I guess, the week is running together, that training towards self-reliance was closing their door as of today. They provide ILS, parenting, and day program services. So we, as a regional center, ran reports, got all the clients, and reached out to service providers that have those service codes, and were able to reach out to see who had openings. So our service coordinators are working to connect clients and families to new services. So you may hear about that. We're always really sad to hear when vendors are closing, and we met with them to see if there was anything else we could do. And unfortunately, it was a business decision and there was nothing we can do. So just kind of wanted to keep everyone in the loop with that. But if you are able to take on new clients and you didn't hear from us, please send me personally an email, and we will be happy to share that with our service coordinators.
Shout out to the service providers that reached out. Like, they got back in touch with us so fast, letting us know who's willing to hire TTSR staff, who's willing to take on new referrals. So shout out to all of you service providers, because we had 9 responses back within 1 business day. So that's huge. And situations like this we don't ever want to be getting good at them, but I do appreciate that we do have a method. I said yesterday during the provider advisory committee that Jennifer Bloom and Tracy and Johnny help out with a lot of these, transitions. Are we starting to see some transitions being made on our spreadsheet that folks are getting connected with new providers? Anyone from the case management world can answer that one.
Hey, good morning. This is Michelle.
Hey, Michelle.
I'm not aware of that, John. I know that conversations are happening. I'm not certain that any transitions have actually happened, but I know that conversations are happening.
Well, it is certainly tough when we have 5 days notice of something like this, and even with the 5 days notice, it really wasn't 5 days notice, because we didn't get the official documents and certainly didn't receive, I think, all the things that we needed. So let's see.
John,
go ahead.
Just wanted
to John.
quickly. So it has started. I know some folks on my team, they've already have the discussion. They're shifting over to other vendors. And so it had started slowly but surely.
Thank you very much. Real quickly, also, Olivia, again, rates, we apologize. We did not give a rate study update yesterday during the provider advisory committee. And so, Olivia, could you just give a quick update on where we're at?
Sure. So we are still waiting for rates from DDS. Robin and her team are going to be working in the next couple of weeks to update rate tables in Sandus. I think we have told this group before that most likely you will see your new rate on your invoice as opposed to getting your rate letter. Those probably won't go out until early to mid-May. There's still some things that information going back and forth, especially with courtesy vendors and just the calculations may being a little off. So we have sent those back to DDS, and I believe we have received 1, 2, and are waiting on batches 3 and 4, which have now been separated out to like 4A, 4B, 4C. So stay tuned. I know it's never, I mean, I wish we had more information to give you at this time, and unfortunately we don't.
But we are on track with what DDS has asked us to do. They wanted the revisions in by the 15th. We turned them in earlier than the 15th. And so, we are doing what on our side, the best that we possibly can do. And when I say we have a number of community services specialists that are on here today. I understand how hard you are all working on this. And so I really want to acknowledge that and appreciate that. And then as I'm doing this, and again, I didn't go through all the introductions, but Carly, this is your first meeting with us, right? So you got to unmute yourself and let folks know who you are.
Yeah, hi, I'm Carly, and this is my first meeting here with Coffee with Community Services. I'm the new employment specialist here at Alta California Regional Center, and I'm very excited to be here and help with developing some new employment opportunities for our clients.
Excellent. Thank you, Carly. You guys will get to meet Carly and get to know her a little bit better. Cindy Lay has transitioned over to that HCBS specialist as Catherine was promoted to the manager of our Woodland office. One last thing real quickly, everyone should have received the RFP orientation invitation for CPP CRDP, and that meeting is going to be coming up here shortly. Again, if you are signed up on our website, you will find it there, but there will be a virtual and in-person CPP CRDP RFP orientation April 27th. And the information, this is right from what was mailed to folks, and I'll run through it real quick, Jordan. We've got 3 that we are RFPing for, crisis support services, and we've got $50,000 tied to that. We're going to do a community crisis home, and we're going to do a group home for children with special health care needs. Again, we've already got a couple community crisis homes, but the group home for children with special health care needs, once again, Alta California Regional Center is going to aim to be the first one of these homes in the state of California. There's us and one other regional center that are going to be piloting this. So imagine a skilled nursing facility and all the things that can go on there, but it occurs in a local community, like in a house right next door to you, a single family home, but it's geared towards children. We already have them for adults. So they're called the adult residential facilities for people with special health care needs. And this is the one that the new model of care that they've developed for children, which are going to be group homes. So really looking forward to this new model of care. Those of you that have been around the regional center a long time know that there's a gap between what is offered with our Bates homes, our small family homes that serve in mainly little kiddos. And then the adult kind of care. And so this hopefully can fill that gap for those someone older and more intensive support needs that children have. So looking forward to piloting that. And I'm hearing people hang up, so it must be 12 o'clock. Look at that, it's 12:01. All right, so this will go out on YouTube. I hope everyone has a fantastic Easter weekend. Hopefully get to spend some time with your families. Take care, folks. And we'll talk to you again next week. And
Thank you.
have a good one.